Good morning, everyone, and thank you for joining me today as we discuss a critical issue in our healthcare system, the nursing shortage. The medical field is essential for ensuring our patients get the best treatment possible. The current nursing shortage, however, is a severe obstacle that has detrimental effects on patients and nurses. This TED Talk will provide a synopsis of the clinical solution, a presentation of the relevant research, and a proposal for the shift in practice that will help relieve the resulting problems. Our analysis will focus on long-stay patients and look at how the nurse shortfall compares to a fully staffed hospital regarding the likelihood of medical mistakes. By adopting a policy comparable to California's nurse-to-patient ratio rule, we can increase patient safety, lighten nurses' loads, and make the workplace more pleasant. The nursing profession desperately needs a solution, so let's get down to patient care problem. Patient clinical problem and available research. As we dive deeper into the issue, my research interests are on effects of the nurse shortage on patient care and working conditions in the healthcare setting that provide long-term care. The PICOT question structure will serve as a basis for our investigation of this issue. My PICOT question is: how does the nursing shortage relative to being fully staffed affect the likelihood of medical errors in long-stay patients? Long-term care facilities residents are the group under consideration here. The analogy is to a situation when all available nursing positions are filled. The impact on patient care regarding the likelihood of medical mistakes is of interest, and the period is the duration of the patient's hospital stay. Numerous studies show that patients and nurses suffer when there are not enough nurses. According to a recent systematic study, low nurse staffing has been linked to adverse patient outcomes, including pressure ulcers, prescription mistakes, and higher death rates. According to the study's finding, overworked nurses were also associated with delayed interventions for clinical deterioration. The nursing shortage has increased work hours and stress for the nursing staff. Sapso et al. 2019 observed that burnout and job dissatisfaction were considerably greater among nurses in understaffed units. This contributes to their having trouble with clinical judgment, making mistakes with patient care, and leaving the field entirely, exacerbating the current shortage. Next, I will talk about the theoretical models I will be drawing from and the obstacles I will be trying to overcome as we attempt to put this practice shift into action in the chosen clinical setting. Practice change. To address the nursing shortage and improve patient care, I propose a statewide implementation of nurse-to-patient ratios based on California's model legislation. The passage of these regulations will significantly alter our healthcare system for the better. First and foremost, patient safety may be significantly improved by strictly following established nurse-to-patient ratios. A well-staffed nursing team may successfully reduce the risk of complications by continuously monitoring patients, quickly responding to crises, and providing timely treatments. Second, enforcing these regulations will reduce pressure ulcers, medication mistakes, and other adverse outcomes. When nurses have manageable caseloads, they can focus on the needs of each patient, reducing the likelihood of medical errors and accelerating the healing process via measures like repositioning and drug delivery. The next expected improvement is in patient satisfaction and outcomes as a whole. With more face-to-face time, patients and nurses may build trust, rapport, and lines of communication. More outstanding communication will result in happier patients and better health for everybody. Finally, these Regulations will make developing a supportive workplace culture where nurses may flourish easier. We will enable nurses to provide excellent and effective patient care by creating a welcoming environment that values cooperation, communication, and ongoing education. How I intend to operationalize the practice change. Implementing this policy shift requires an in-depth analysis of the current nurse-to-patient ratios in our hospital. Identifying problem areas and making informed judgments about fixing them require thoroughly analyzing existing employee numbers and distribution. After we have a firm grasp on where we are now, we will evaluate our results in light of the evidence-based standards about the ideal nurse-to-patient ratio. My strategy will be based on this comparison, which will help us spot gaps and create well-considered plans to close them. Next, we must develop a detailed outline for reorganizing our workforce to achieve the ideal proportions. Our strategy will look at creative ways to change schedules, reallocate resources, and add additional employees. I will compare different scheduling models, may be compared to one, to determine which ones best distribute nurses throughout the day, guaranteeing that patients get the care and attention they need at all times. In addition, we will investigate redistributing resources like support personnel and equipment to ease the workload of our nursing staff and improve the quality of care we can provide. We must keep lines of communication open with our nursing team throughout the implementation phase. The practical implementation of this practice shift will be significantly aided by our ability to request their input and include them in decision making. Fundamentally, putting this into effect requires a systematic, multi-pronged strategy that takes on the significant issue of modeling nurse-to-patient ratios. We can improve the quality of care of our patients by carefully evaluating the existing state of affairs, developing a thorough strategy, and collaborating closely with the nursing staff. Theoretical modeling and overcoming barriers. Lewin's change theory provides a valuable and applicable paradigm for directing the rollout of our suggested procedure redesign. A seamless transition to the appropriate nurse-to-patient ratios may be achieved via a three-phase of this well-established theory: unfreezing, changing, and refreezing. Tan and Granoff, 2020. I shall use great efforts throughout the thawing phase to instill the feeling of urgency over the need for change. Stakeholders may be persuaded to implement the suggested practice change by emphasizing the detrimental effects of the present nursing shortage on patient outcomes and their nurse well-being. When I reach the transformation phase, I will prioritize creating a welcoming setting where new nurse-to-patient ratios may be implemented smoothly. To achieve this goal, we will implement training education programs to give our nursing staff, the knowledge and abilities they need to flourish in an environment with more human resources. In the last step, refreezing, we'll make sure the new methods stick by writing it into our facility rules and procedures and monitoring how it affects patient care and nurses' morale. This will guarantee that the shift lasts as long as possible. I will work actively with stakeholders such as nurses, managers, and politicians to solve implementation roadblocks. Collaboration and shared commitment to the success of the practice shift may be fostered by directly addressing their concerns and presenting the evidence-based advantages of appropriate nurse-to-patient ratios to ensure the smooth adoption of our suggested procedure modifications. We will investigate and resolve any potential underlying structural, cultural, or resource-related barriers. Internal evidence sources. I will use various in-house evidence sources that are directly related to the goals we want to achieve as a result of our suggested practice change. We can learn a lot about the effects of nurse-to-patient ratios on patient care and our nursing staff satisfaction from these resources. Patient satisfaction surveys are important internal source of evidence because by comparing data from before and after implementation, we can determine whether or not the practice change has improved the patient experience in terms of communication, attentiveness, and overall quality of care. Mendel, Davis, and Suspect, 2019. Medication mistakes and pressure ulcer rates provide fuller, crucial internal evidence. These indicators may show if the shift in practice has improved clinical results and is directly connected to patient safety. We will also monitor patient burnout. We will also monitor nurse burnout rates, which may shed light on how the transition has affected the health and happiness of our nurses. Staff retention and the quality of patient care may improve if burnout rates are lowered. We can successfully show the beneficial effects of our suggested practice change by gathering and evaluating this kind of internal information. Using this data-driven method, we can confirm the successful adjustments and pinpoint where our processes might be strengthened. Ethical considerations. When I'm conducting an ethical consideration, the nursing shortage and setting reasonable to nurse-to-patient ratios, this approach aims to improve patient care. This is done by under the ethical principles of beneficence and non-maleficence, which require us to prioritize our patients' health and safety. The concepts of fairness, which calls for a reasonable and equal allocations of resources and care, must be considered in addition to these essential values. All patients, regardless of their requirements or circumstances, may get the care they deserve with the help of adequately implemented nurse-to-patient ratios. In addition, we must recognize the autonomy principle, which calls for treating each patient with dignity and respect their right to make their own decisions. Patients will be better able to take an active role in their care and make educated decisions about the treatment if nurses' workloads are reduced and more individualized care is provided. Finally, we need to think about the ethical consideration of our healthcare providers, and the health and morale of our nurses will benefit from this plan's effort to lower the stress they feel on the job, lessen the likelihood of mistakes being made, and improve morale in the workplace. We can confidently proceed with our plan if we adhere to these ethical standards, ultimately leading to improved patient care and the results. Evaluating outcomes. We will use a thorough and systematic strategy to determine how our suggested practice shift would affect the results. Patient satisfaction, medication mistakes, pressure ulcers, adverse effects, nurse burnout rates will all be measured as baseline before the new nurse-to-patient ratios are implemented. On Afterman et al. 2018. I will collect and analyze data at regular intervals to track the long-term effects of our intervention after the recommended nurse-to-patient ratios have been put into place. This kind of ongoing analysis will help us gauge the success of the transformation by revealing any new patterns or trends. Patient, family members, and nursing staff will be asked for qualitative input in addition to quantitative data. Understanding how the people impacted by the policy shift feel about it will help us anticipate and address any problems that may arise. The effect of our interventions on patient care and nursing practice may be more fully understood by integrating quantitative and qualitative data. Taking a data-driven, evidence-based strategy will help us achieve long-term success and ensure the value of our initiatives. Disseminating findings. Sharing the results of our change efforts is essential in raising public awareness and motivating constructive actions within the nursing community. To guarantee that our findings are widely disseminated, we have the greatest possibility impact. We will use a variety of strategies. I will begin by presenting our findings to the nursing staff and hospital management, detailing both projects